Tonight we're going to be talking about BodyFX. This system is something that is new to us. It's on the same platform as our Fractura, and it's going to be on the same platform as our IPL that we're going to be introducing in February for brown spots. So we got lots of new and exciting things going on here. This is the newest generation of lipolysis, which means it's the newest generation of fat blasters. Permanent fat reduction, which is new for us. We've had things before that would shrink the inside of a fat cell, but we've never had access to things that actually destroy some of the fat cells that we don't want. The advantage of the BodyFX is minimal discomfort, and we have Peggy going on here as we're speaking. So you can see that Sona's doing Peggy and she's perfectly fine. What you feel, because I've had it done, I'm trying to treat my abdomen. It'll suck the tissue up into the head of the device, and it'll give you just a little at the end. Whenever you hear that little dunk is when you feel just a little zip, and then it's gone. So it's not hot like some of the traditional equipment that we used to use. It's fairly comfortable. By the time it's done, you're ready for it to be done, but it's not that uncomfortable. There's no downtime. You'll see a little redness. I put a slide in here for us so that you guys can see what the area looks like after it's done. There's no downtime, just a little pinkness. From doing my abdomen last week, if I press or if I rub hard in certain areas, I can tell I've had something done and it feels just a little bit tender, but it's not an issue. I kind of feel good because I think, yeah, something's going on in there. It's permanent fat reduction, as I mentioned before. So a representative, when he was here, he saw this in my room, and I thought this was the best example of what this machine does, that I always pull this out if we talk about BodyFX. But if you think this is your entire fat pad of your stomach, and it's a little off because there's 4 sections here, but we're going to remove the top 30% of the fat layer. So it would be this one and a little bit of this one. So if you think about an area, you know, this is really good for problem spots. Say you've got saddlebags or a little extra in the abdomen or on the arms, you have to think about decreasing that by 30%. Even a larger abdomen can decrease by 30%, and that person can be happy. It's intended for trouble spots, but as you'll see in some of the photographs, it'll work no matter what size we're working on. It'll smooth cellulite, which is very exciting because we've had a lot of technology in the past that says, oh, it's going to smooth cellulite, and nothing is a cellulite smoother. That is a genetic problem that we have to work on, but the studies show there are lots of improvement with cellulite treatments. Well, this is not hurting enough that Peggy and Sona are talking and laughing, so that's perfect. It reduces circumference area, so you will see a significant reduction. If you do the abdomen, you're going to see a reduction around the waist. You do the thighs, you are actually going to see a reduction in circumference. The studies are showing that there are no non-responders. We've had equipment before that will do somebody and they'll see a little bit of change, but you know, it's not something that they're excited about. With this, there are no non-responders. Everybody has responded. And this isn't my studies. These are the official biopsy studies that the company has taken themselves. So that is real exciting news that we are seeing no non-responders on our new fat blasting. So this is what the handpiece looks like. Hey, Sona, can you stop for a second and just hold this up? So this is what we're working with. A little bit. So what this head is going to do is going to combine radio frequency energy with deep tissue heating and suction coupled negative pressure. In other words, what it's doing is when we put this on Peggy's big tummy here, it's going to suck part of it up into this little head, and it's going to shoot the radio frequency waves here and send some heat into that tissue. And that combination is what's going to actually help break down that fat layer. Just so that you can see what it's doing inside the tissue. Just as I said, it's going to draw up a portion of the extra fat layer, and it's going to shoot the radio frequency here and send the heat down, and that's what's going to actually break down that fat cell. And then the fat cells are sent through the body, and they're excreted as normal waste. Common areas treated, it's just about anything really. I mean, currently we have lots of people that are in the middle of series because we started this actually when we introduced Fractura. We mentioned BodyFX and several people went ahead and started at that time. We're treating a lot of the bat wings, I think people have been calling them. A lot of abdomens, thighs. We can treat inner thighs, outer thighs. We are treating the front of one woman's thigh because she has quite a bit of cellulite down the front, and that's the problem. She's sort of got that anterior arch in her thigh. Knees, because a lot of people get a lot of fat deposits around their knees over time, so we can treat knees. Hips, flanks, back fat. Back fat's a big problem with women, maybe not with the men so much, but we get a lot of back fat. Benefits of the BodyFX is a wonderful alternative to liposuction, and that's very important. As a former plastic surgery nurse, liposuction was wonderful and helped a lot of people. However, when you go and you remove a lot of fat cells from an area and then over time you gain some weight back, you're going to find that you redeposit those fat cells elsewhere. You're born with a certain number of fat cells, and when those fat cells are permanently removed, then when you gain weight, you're going to gain weight elsewhere. We're not removing that much of that fat layer. We're only removing the top 30%. So that area, if you gained weight, you would gain a little bit of weight there again, but it would not be that top 30% is gone. It treats a larger area than other comparable machines. There's some machinery out there that will treat a very small fixed area at a time. So it's very costly and very time costly to go in and treat a small area at a time. With this, as you see, we can treat a larger surface area. And what we consider an area, just because we had to have a starting place, is 4 hands. So if we're treating your abdomen, it's 1, 2, 3, 4. For treating thighs, it's 1, 2, 3, 4. So that helps you just kind of think in your mind about what area you wanted to treat and how big of a surface area will cover. We have a permanent destruction of fat cells, the top 30%. So it's not just shrinking cells. As I said, we've had technology before here, and the technology was wonderful because it would shrink the inside of the fat cell and people would see a reduction, but they had to come every week for 8 weeks, and then they had to come every month to maintain that. If they didn't and they gained 5 pounds, that area would start getting larger again. That was really disappointing after spending the money and spending the time to get that done. We love this machine, and you guys know us. If we can find a safety measure, an extra safety measure on a machine, that draws us to it because we really want to make sure that we keep you safe, number one. So with what Sona's doing, she has set this machine at a cutoff rate so that whenever Peggy's skin reaches a certain temperature, it's not going to fire again. It's just going to say, whoop, and say, we're hot enough here, it's working on the inside, we're not heating any hotter. As a separate safety measure, if we have any question at all about that, we can look at the top of this head. When you finish this one, I want to see it. And it's telling me, whenever I put this on Peggy's skin, it's telling me what her skin reads. So it's a double safety measure. We're able to tell exactly what we're putting in and what we're getting back. And that's nice. We won't get any blistering or burning with this unit. And as I said, the skin temperature cuts off as an extra safety measure and a comfort measure. So the way the series is done, we do a series of 8 treatments. So we see you once a week for 8 weeks. And over that period of time, we're going to treat your area. We treat 10 minutes per area. It's 10 minutes per hand, so it'll be 10, 20, 30, 40 minutes. We heat up for a couple of minutes. It's going to take 40 minutes to heat an area. Let me get you cleaned up. So just plan on about an hour per session, probably a little bit less than that over time. First visit's going to take a little bit longer because we want to take some measurements and some photographs so that we have something to go back on. Maintenance is something that we've talked to a lot of people across the country. We've gone to we went to Chicago for some training in December, some advanced training, and talked to some different people. Some people say that they don't see their patients back for maintenance. They're happy with what they got. Now, we see it as you're aging and your skin is going to continue to soften in those spots, maybe not gain fat, but the skin will need to be tightened. So we say you might want to consider a maintenance treatment every 4 to 6 months. If you have cellulite issues, you certainly would want to consider maintenance treatments because cellulite's a genetic predisposition. That's not going to go away. We're going to have to keep working on that to keep that smooth. But the fat loss is permanent. Now this is what the tissue looks like immediately after. That's usually gone by evening. We mark you with a highlighter pen because when you stand up, you look different than when you lay down. So if we don't circle what we're working on and make some notes while you're standing, you lay down and we think, "Guy, you look great. What are you doing here?" So we like to go ahead and draw it out. And That's right. But it just is the redness, and you'll see on Peggy's abdomen, it's just a red, can look a little bit like it's got some little stripes in it, but it does fade by evening. And I have several before and after pictures because I wanted to show you some different body parts. These are from people that are using the machine from across the country. But you can see the back fat and how it just smooths it out. And that's what I want you guys to see as realistic expectations. We're not going to be able to take it down more than that 30%. Now, if you wanted to do another treatment series, we could work on the next 30%. But what we're anticipating in a treatment series is just tightening and smoothing that top fat pad. So in this slide, they worked on abdomen and they worked on lateral thigh. She didn't have much of an abdomen, but they made it look even better.
I'll take that.
Really.
I'll take before.
This is a good one though. As I said, it can be a larger abdomen. She's feeling good about losing that top 30% of that fat pad. Work on the top of the hips, the abdomen. Another back fat. And that's another abdomen. We all, especially women, tend to get a little fuller in the abdomen. We're doing a lot of abdomen work right now. And happy with what we're seeing. And I've had 2 treatments. I don't want to over promise on this, but I've had 2 treatments on it and I can tell that the skin feels firmer. I don't know that it's smaller, but that skin has more body. It feels like it's kind of standing up on its own a little bit better, where it's just a little wobbly mess in there. This is a good photograph of cellulite, and you can see that she even had some asymmetry that's been repaired by doing the radiofrequency and tightening up that tissue. But this is a case where she'd need to come every 4 to 6 months and get a touch-up treatment just to make sure that that area stays smooth. Another abdomen. And you can see the tightening. It's not like the old systems where we were just shrinking the inside and you had all these fat cells, still the same amount of fat cells there that were able to expand greater. And they would. If you gained 10 pounds, they were going to expand. You were going to gain weight there.
Once they're gone.
Yeah, you were born with a certain number of fat cells, and once they're gone, they're gone. That's why with liposuction, sometimes if somebody does their abdomen, they'll notice they gain weight in their thighs. I don't know if you've ever known anybody to do that, but sometimes that's what you notice is a redistribution of that fat. Oh, Janet asked if how the fat cells leave the body, and they're excreted through the lymphatic system. A gentleman that they did the abdomen on. Another example of cellulite. So you see how it really has smoothed that cellulite out quite a bit. And that is a hard thing to do. That cellulite is stubborn. Another abdomen. I like this one because this tells you whenever you bend over, you really are full, and that's whenever you can feel it. The question was asked, if you do another treatment series, would you lose another 30%? And I asked that question of the company, and they said yes, that you would continue to work on that fat layer. Now, just the safety nerd in me, I would probably say, let's take a 2-month break. Let's just take a 2-month break, and then we'll resume again, just to get. They probably would say it wouldn't even be necessary, but I feel like that would be a safe thing to do. Another abdomen. And you can see, like even the positioning of the navel, you can see that it scoots up. It tightens everything kind of up and in. Working on the abdomen. Now, the next slide, because I know that whenever we introduced this treatment at the Fractora launch party, we had some questions about this. And for instance, for me, my legs have never been a problem as far as the circumference, but just turning 40, losing weight, sun damage, all of that, I had a lot of crepey skin on my thighs. So I chose to do the Fractora. This is not my knees, but I chose to do the Fractora on my legs because I didn't want to burn the fat. I didn't want my legs any smaller. I've got a little cellulite, but what I really wanted to do was thicken the skin on my legs. So I did, Peggy did Fractora for me right here. 2 weeks ago, and now I'm really starting to notice that that skin is tightening back up. And there, this woman had, this is not our patient, but she had some fractura on the knees. Peggy did fractura on her knees today, so you'll be able to see what that looks like afterwards. She did it at lunchtime today. Peggy's just a radio frequency queen today. This is another client of ours that has agreed to let us use her photographs, and this is Shelly. She likes to wear sleeveless tops and just had that crepey skin that was driving her crazy. So this is after one treatment. So you see the difference right here and here. So that is using Fractora because her arms really didn't have a lot of excess weight. It was just that skin texture. She was pleased with what she had otherwise. But you can see how it's just kind of tightened that skin up and smoothed it. And it's thicker. Whenever you run your finger over that skin, it just feels a little bit thicker.